Okay, we're ready to start.
Order now. Will the clerk please call the roll?
Fradham,
Here.
Maris Castillo,
Here.
McDonough,
Here.
McGuire,
Here.
Ortega,
Aye.
Reinhardt,
Here.
and Carter.
Here. Thank you very much. I'll call on Commissioner McGuire for our Pledge of Allegiance while we mute, while the rest of us mute.
Thank you. Thank you, Madam Chair. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you very much, Commissioner McGuire. The agenda of the November 16th meeting is before you for approval. Is there a motion and second?
So moved.
Second.
Thank you, Commissioners McGuire and McDonough. Are there any questions on the agenda of November 16th? If not, I'll ask the clerk to please call the roll.
McGuire,
Aye.
Ortega,
I know he's there.
Aye.
Thank you. Reinhardt,
Aye.
Fradham,
Aye.
Maris Castillo,
Aye.
McDonough,
Aye.
and Carter.
Aye, thank you. The agenda has passed, and we'll move on then to the minutes of November 9th before you for approval.
So moved. This is Victoria.
Second.
Thank you, Commissioners Reinhardt and Ortega. Are there any questions then on the agenda? I'm sorry, on our minutes. Thank you. Will the clerk please call the roll?
McGuire,
Aye.
Ortega,
Aye.
Reinhardt,
Aye.
Fradham,
Aye.
Maris Castillo,
Aye.
McDonough,
Aye.
and Carter.
Aye, thank you very much. Our minutes are approved, and we will move on then to our ordinance procedure. A motion is in order for the 2022 Capital Improvement Program Bond Ordinance to waive the second reading. Is there a motion?
Move approval. Second.
Thank you. There's a motion and approval on the 2022 Capital Improvement Bond Ordinance to waive the second reading. Are there any questions? Will the clerk please call the roll?
McGuire,
Aye.
Ortega,
Aye.
Reinhardt,
Aye.
Fradham,
Aye.
Maris Castillo,
Aye.
McDonough,
Aye.
and Carter.
Aye. Thank you. The public hearing for the Ramsey County Board of Commissioners proposed 2022 Capital Improvement Program Bond Ordinance is now open. There's no vote taken for the public hearing today. The hearing on the proposed program bond ordinance is to allow the public an opportunity to comment on the proposed ordinance. I understand that there is no one signed up today to speak. I will, in that case, I also understand that although we are in webinar form, there is no one signed up to speak either in person or by webinar. As that is my understanding, I will ask if anyone is here to speak 3 times before we close the public hearing. Is anyone here to speak regarding the proposed 2022 Capital Improvement Program Bond Ordinance? Is anyone here to speak regarding the proposed 2022 Capital Improvement Program Bond Ordinance? And a third time, to be sure, is anyone here to speak regarding the proposed 2022 Capital Improvement Program Bond Ordinance? I declare the public hearing is now closed. Thank you very much. And we will be voting on that bond ordinance in a future meeting. We will move on then. I'll call on our county manager for the COVID update. County Manager O'Connor.
Thank you, Madam Chair and members. Good morning. I am looking to the screen, and this is that magical moment when the public health team appears. I'm going to go right to them to start, and I don't know who's kicking it off today. So Director Holly, you tell us who's kicking it off.
Laura Anderson will kick us off. Thank you.
Good morning, County Manager, Commissioners. I'm going to kick us off here with some data from our partners at the CDC. Mike Lindsay, could you go ahead and share your screen, please? Thank you very much. This is disheartening news for us as a community. Just a reminder, as of July 27th, we were sitting at about 54 cases per 100,000. As of yesterday, the CDC reports that our case rate is now at 350 per 100,000 here in Ramsey County. Our positivity rate is around 9.3%. We haven't seen positivity that high since April of 2021, when I will remind you, vaccine was very sparse. Mike, could you go ahead and move us now to the Minnesota Department of Health? I wanted to touch on this page because we have been receiving a lot of queries, around vaccine breakthrough cases. So the state has added some new detail to this webpage, which describes the impact of breakthrough cases on our general population. I want to caution us briefly before, actually, could you scroll back up, Mike? I am going to go ahead and ask you to pardon me, scroll back down, expand further down the screen. You will see some new charts, and I'm just going to have to, yep, thank you. This is exactly where I want to be. What I want to show the board and our general population is the impact of vaccine on our case rate. The green line are individuals who are fully vaccinated. That blue line is individuals who are not fully vaccinated. We continue to see increasing cases, obviously, among those who are unvaccinated. Mike, would you go ahead and toggle through to hospitalization and death rate on that same chart? Thank you. This is again where you can see truly the impact of vaccine on our outcomes. Vaccine is doing its job. It's preventing hospitalization and death in our community. So I do want all of you to be able to reiterate that to your colleagues when you get questions about breakthrough cases again in our community. Another reminder about this data, it doesn't include, it doesn't control for factors like age. So if we think about who's been eligible for vaccine longest, we will recognize that individuals who have been vaccinated earliest and longest are those who also are older and higher risk. Remember that children under 12 weren't eligible until 11 days ago, and teenagers ages 12 to 17 were not eligible until September. I do want now to say that, individuals who are in those client-facing jobs should seek, frankly, a booster as winter sets in here in Ramsey County and across Minnesota. We do have boosters available at our community-facing clinics, including Arlington, Oxford, and just last week, New Brighton Rec Center. So let's take a look at the vaccine dashboard next. Mike, if you could toggle over to that. Some good news, we saw an uptick in our overall vaccinated status from 72 to 73% as of this past Monday. Residents who are 12 plus, they are still at 80%, having received at least one dose. Scrolling further down to that summary, Mike. I want to share, as of, again, yesterday, we had administered more than 58,000 doses at 409 clinics. Last week, we were able to administer a little under 300 doses, but this coming week, which actually started on Sunday, we anticipate administering 1,200 doses. And my colleague, our director, will go ahead and describe more on those upcoming clinics. Thank you.
Thank you, Incident Commander Anderson. Good morning, Madam Chair, Commissioners, County Manager O'Connor. It's great to be back here. As Incident Commander Laura Anderson mentioned, our rates are rising. And so I just want to send the message that we want to continue to offer vaccines to as many of our community members that are eligible for vaccines at this time as possible. We continue to offer those third doses or boosters. As of Monday, we have given 452 third doses at our Ramsey County sites. As of last week, we launched our pediatric vaccine clinics. I just want to give a huge shout out to the public health team. I think this was mentioned last week that public health continues to be dedicated to providing services to our community. We have a number of staff that run and operate our vaccine clinic sites that I just want to mention this morning. We have a number of site managers, Carl Ramirez, Zatali Chavez Ayala. We have folks working in logistics, Kathy Duffy, Dennis, Capo Verde. We have Mark Jackson, who you all have met before, who's been working and leading this team for some time now. We have many, and these folks I've met many times, our Medical Reserve Corps led by Brian Brown. We have a number of staff that are making sure that we have the proper doses at our vaccine clinic. So I want to give a shout out to Ann Kettle, Amanda Thibodeau, our child and teen checkup staff, Jenny, Himali. We have family health nurses that are contributing to this, you or her, and of course our communications team, Chris Burns and Greta Stark. And I'm just mentioning a small number of people this morning, but there are many people that contribute to the success of our clinic sites and reaching our community. It's time for our community to get vaccinated, and we are working very strategically and urgently to get information out to our community partners, to the residents of Ramsey County, to ensure that people have access, readily have access to vaccines, both their third dose, their first dose, their second dose, right, and getting our kiddos vaccinated. We gave out 897 pediatric doses as of Monday. That's incredible. Again, we want to continue that trend. Yesterday, we launched our school sites at Como Park Elementary, and today we're launching Battle Creek Elementary. We have ongoing appointments that are available at these sites on November 29th at Como and November 23rd and 30th at Battle Creek. We learned very early on, I would say, as we saw our state open up for offering vaccines, that there were some inequities and people that had access to vaccines right away. And so Ramsey County really wants to get ahead of that curve this time, particularly for our pediatric clinics that we're offering for vaccines. And so we are going to be working very closely to offer pop-up sites for some of our trusted messengers that we know are working directly in community, that have access to the communities that want vaccines or that maybe have questions or still are, maybe on the fence. And so we want to make sure that we're leveraging those partnerships to get information out, but to also have some really targeted approaches. So what we offer in community. And so this Thursday, November 18th, we'll be offering a Trusted Messenger Clinic. We have details to follow on that. Madam Chair and Commissioners, we continue to offer our $50 incentive for first and second doses, and we'll continue that while supplies last. And I just want to close out by saying, we have the holidays approaching, and we have people that will be traveling across the United States and maybe internationally. And I just want to stress that mask use is still so important, as Incident Commander Anderson mentioned, but getting your vaccine is so much more important, right? As we think about what Laura Anderson just mentioned. And so if we think about the mitigation strategies that we've talked about here at the board meeting over and over again, I think each and every Tuesday, that layered approach that Dr. Ogawa and Laura mentioned around getting your vaccine, wearing your mask in crowded places and indoors is really important during this time. And so we're just urging community to, visit one of our vaccine clinics. You can go on the MDH website to get more information. If you're listening this morning and you want to get access to a clinic right away, There are so many options right now for this, and so we're just urging community as we move into the holiday season to get their vaccines. And Dr. Ogawa will talk a little bit about third doses and also address some of the concerns that I think we have as we move into the holiday season around, should we go out to these big gatherings, right? Where should we be present? Should we travel? And so I think this came up, I think last week, a couple of times. So I just want to thank you all for allowing us to continue these COVID-19 updates. I think they're so important, and we'll continue to work with community and in community to make sure our communities remain safe and healthy. Dr. Ogawa?
Madam Chair, County Commissioners, my voice is very squeaky right now. I'm not sure why, but I'm not sick. It's just, I think a frog in my throat. So I do want to touch base and follow up on a number of the comments that were made. One is that the data that Laura Anderson showed clearly shows that travel, meeting in groups for individuals who are not vaccinated is exceptionally risky right now. And so really individuals who are not vaccinated, and quite frankly, that includes children who are eligible but who haven't been able to be vaccinated yet. Families need to really think carefully about potentially exposing them out in the public where our transmission rates are rising and the highest we've seen in a long time. In addition, individuals who are immunocompromised also need to think carefully about this, especially so as we see overall rates rise. Clearly, we're going to see more cases in everyone, including, as the data points out, even those vaccinated. And with each of those levels of transmission, we worry about both individuals who will get ill. Hopefully, the vaccine will the vaccine will do its job, keep you out of the hospital and keep you alive. However, it will continue to transmit and potentially change and mutate. So we want to be very careful. That's where that layered approach that Director Holly mentioned, wearing masks, not gathering in large groups, and still being cautious. I know that we are all very tired of being isolated and we want to share with family, but we also want to be safe. The other issue is boosters. Sometimes we use boosters and third doses interchangeably. We're trying to be a little bit careful about that, but the reality is that everyone is a third dose, and so sometimes it gets mixed in there. But individuals who received Moderna or excuse me, Pfizer are eligible for a booster if they are 65 and older, if they are 50 and older and have an underlying health condition, if they're 18 and older and they work in a high risk situation, they're all eligible for a booster. And I would strongly encourage that individuals get their boosters, especially those who are at risk actually in their work setting or in their living setting, in congregate settings or things along those lines. Getting individuals who receive Johnson & Johnson initially are also eligible, period, if you're 18 and over, for a booster 2 months after your initial one. A lot of family and friends are asking me, should I mix and match? Should I get the same one that I got? The data is, the clearest data is for individuals who receive Johnson & Johnson. And for individuals who receive Johnson & Johnson, there's some good data that shows that if they get a second dose of one of the messenger RNA vaccines, their immune response is actually higher than it was even initially, or at least very close to that. So for individuals who receive Johnson & Johnson, if they have no contraindications to get a messenger RNA vaccine, I am recommending that they get a booster with the messenger RNA vaccine. For individuals who receive Pfizer and Moderna, the data is a little bit more mixed. And if you, a quick glance at the data says maybe you should swap. However, when you dive a little bit more deep into that data, there's a difference between Moderna and Pfizer in the first place. Moderna tends to retain, individuals who receive Moderna tend to retain their immune response at a little bit higher level to begin with. And so when you compared them getting a Pfizer booster and a Moderna booster, the difference is negligible. So if an individual received Moderna first, I tell them, you know what, the reality is either is just fine. Pfizer, if people received Pfizer first, there is some data that shows that receiving a Moderna booster may raise their immune response a little bit better as well. I think underlying all of this is that Moderna tends to incite a little bit better immune response to begin with, but it's a little bit difficult for us to say. The other thing that I tell patients to take into account, though, is if you tolerated the Pfizer and you got Pfizer first, getting a Pfizer booster is just fine. And right now, Pfizer is the easiest to get. And so going back to even when we started, the best shot for you is the one that you can get the quickest, because it's really important right now, especially if you're going to be meeting with family, visiting with friends, and things like that. I am being a little bit of a party pooper, but if individuals are highly at risk, elderly, and there might be individuals who are unvaccinated within that group, I strongly recommend that people at the very least wear masks and get tested before they're around each other. I think we talked about that last time. I think being tested before you're going to meet, whether you're vaccinated or not, especially if there are individuals who are at high risk, is very important. And so, again, the layered mitigation, vaccine, masking, testing, not staying in crowded spaces for long periods of time, all the other things too, washing your hands, being careful, are important as well. But these are just all things, and unfortunately, as Laura Anderson pointed out, our numbers are the highest they've been in a long time. And that means everyone is at risk again to get the infection. And so being extra careful is very important right now. I think those are the main things I was going to point out. I'm going to pass it back and then also be available for any questions.
Madam Chair, you're on mute.
Thank you. I see two hands up, and so I'm wondering if before we move forward, we might check in with Commissioners Ortega and Commissioner McGuire for their questions. Commissioner Ortega.
Thank you, Madam Chair. Excuse me, Dr. Ogawa. Again, you know, I have constituents that ask me some really smart questions. One of them that was posed to me this past week was, if you know, you have all the newspapers talking about the fourth wave, so to speak, and that's at least from their understanding and mine too, to some, that's the Delta variant, right? At what point, but the vaccine we are getting is pre-Delta. So as the variant mutates two down from where we were, at what point do we need to have the vaccine recalibrated, if that's the correct word? It's a good question, because are we vaccinating with the appropriate vaccine at this point?
Chair Carter, Commissioner Ortega, that's a great question. And actually, so a few things. One is when we look at the Delta variant and we look at the current vaccine, the changes to the protein, some of the actual genetic changes did occur within the proteins. However, when we look at the level of antibody response and immune response, it's still adequate to kill the virus ultimately. Part of the reason I believe that we're seeing cases, though, is that it takes a little bit longer for it to kill it. And so there is some disease created in the host, okay? The reason that we're recommending boosters, though, is we do believe, and some studies have shown, that if we boost right now the current vaccine formulation, we get very good results again. We get back to that level that we saw against the initial virus. You ask how many iterations do we need to get to? Don't know. Probably one or two, you're right. The CDC, and I trust my CDC colleagues in this, are regularly genomically sequencing viruses that are identified in individuals who are sick, often focusing on those who are in the hospital and those who are having breakthrough cases. Our state is doing the same thing because that's where we are most likely to see the virus changes that are the most dangerous, right? It's the ones that are more infectious and more dangerous. So they are genomically sequencing those regularly, watching to see where those gene changes are and whether or not the proteins have changed enough to evade our vaccine. I can assure you too that the Pfizer, Moderna, all of them are also looking at multiple formulations. It's hard though, because you can't predict what the genomic change will be. So it's a little bit hard to get out in front of variants because you need that genetic material to create the vaccine. So as best as they can, the other thing that's very important about messenger RNA versus viral vector is they are what we like to call plug and play. Once we have a genome, we can replicate it, plug it into the same lipid coat, and then inject it. So I do see that the ability to respond will be relatively quickly. It's just hard to do it ahead of time.
Thank you very much.
And thank you, Commissioner Ortega. Commissioner McGuire?
Thank you so much, and I just really appreciate all the work of the team, and I really appreciate our ability to be able to ask these questions because, as Commissioner Ortega said, you know, we're all hearing from members of our family and from the community all these questions. So I just appreciate this time. So I do have a couple of questions. Just to start out with, you know, we're obviously hearing these horrible these unfortunate numbers, and they're saying, you know, that of course in Minnesota, I feel like we're trying to do everything we can, and certainly in Ramsey County we are, but they, you know, our state has the highest numbers. How can that be? Well, I mean, I can't imagine we're higher than some of these other states that I've heard about without, you know, doing the vaccines and all of these. I mean, I know that Ramsey County is doing, I think, better in our state, but why? Can you just shed a little light on that, on your speculation on why that would be?
Everybody wants to jump off. Laura, would you like to?
I'd like to take this one. Yeah, Chair Carter, Commissioner McGuire, what I would say is we did see similar escalation last winter as Minnesotans went inside. We kind of tend to act as the sentinel state, you know, for winter. It gets cold up here faster, so people do move on indoors, and as they move indoors with a variant like Delta, and even 20% of your population not fully vaccinated, you're going to start to see cases like this. Yeah.
Okay. Thank you. I know where there's other northern states, so I still thought, wow, how can it still be us? Since I feel like we are doing, you know, as good a job as we can, but I know that certain counties aren't doing as well as our county is. So just thanks for all of that. So my other question is for you, Dr. Ogawa, because as we know, the holidays are coming, and I'm the one asking these questions because my family does want to gather, and we have elderly, and we have immunocompromised people, and we have young children who are not able to be vaccinated yet. But and unfortunately, most of them have already caught the virus. I mean, they've already been sick now, so they're waiting their 10 days after they're sick, so they all think they're going to be fine for the gathering, but are they really fine for the immunocompromised and the elderly that are going to be in our group? I mean, what are you recommending for families who've had children that have already gotten it and they feel that they're immune now?
Chair Carter, Commissioner McGuire, that's also a really good question. When we look at the data that says when it's okay for people to be off quarantine, it's shifted a little bit, right? In the beginning, we were saying, okay, everybody has to stay away from everyone else for 14 days after they have the infection and after they test positive. When they looked more closer at when people actually stopped shedding the virus, they found it closer to 10 days. And so they made a reasonable recommendation that people could begin to leave isolation at 10 days. That is pretty good data. It's a little bit hard though, because it's an average, right? Young children do have a better immune system than those of us who are older. So we do believe that they also are not as infectious for as long. Individuals who have been vaccinated, we also have found good data that shows that they are also infectious for a shorter period of time, ideally. We definitely know that if individuals received antibody treatment while they were sick, they are also probably less infectious sooner, but it is a risk. Masks and masking will help protect that as well, because that is a mitigator that slows spread. Lots of fresh air, outdoors, distancing, also all reduce that risk of spread too. Those would be my general thoughts. It's an estimate and it's a guess though. Yeah.
I really appreciate that. It's hard to say, and we'll be masking for sure if we actually still go. And so, but I think you're right. I think we're gonna all figure out what's our comfort with our risk level, and so we'll see. But I really appreciate your answer on that. And so my last question is, of course, I feel lucky, and we're all lucky here that we get to ask you these questions on our Tuesday board meetings. I'm always saving up my questions for you. Is there going to be another opportunity for the public to have a conversation with Dr. Ogawa? I know that they're very popular with our residents, and so I'm just curious if you have another one of those planned.
We don't have one planned right now, but I'm sure Director Holly will update as to whether or not that's an option. I will share that I'm also working with the city of St. Paul right now with their employees, similar to how we did with our employees at Ramsey County, talking about vaccine, getting information out there as different situations occur where individuals need to be getting vaccinated, of trying to get the message out about the importance and just general information about the vaccines, because we know the more we give information and the more we get trusted messengers, both, quite frankly, both from the community and medical to individuals, the more change we can make, right, in terms of people feeling more comfortable with getting the vaccine and doing that. And so I look forward to more community conversations. And now Director Holly will tell me when I'm supposed to be somewhere, and I will show up.
Madam Chair, Commissioner McGuire, you read my mind. A week ago, I was thinking about this, and I usually prompt them, right, Dr. Ogawa? I think me and Allison Winters, but it's important, these community conversations. I would also say as we move into more work with our trusted messengers, Dr. Ogawa was a great resource and advisor to our trusted messengers and connectors that have some of the same questions. And so on a day-to-day basis that we're getting from community. So we'll continue to think about creative ways to get community engaged, both virtually and just kind of on an ongoing basis. As I mentioned last week, we're doing a direct mail piece where we're encouraging families to get their kids vaccinated. And so we're continuing to work with communications and our trusted messengers to figure out ways that we could do outreach and engagement to communities most in need, to also just provide education and information about the vaccines. I think it was mentioned last week that we still have a lot of parents, caregivers, and caring adults that have questions about pediatric vaccines, to be frankly honest. And so I think we have a great vaccine team that can provide education on site, but we also want to make sure, as Dr. Ogawa has mentioned, that we're connecting with trusted members of our community to also be those peer educators and informal and formal health educators. It's so important that we do that. I want to mention something too with our child and teen checkup team that have continued to do this work around outreach. A number of folks in that team have been redeployed, and they remain redeployed to do this work. And the message that I think I received from that team is that the outreach and engagement and relationships that we've built during this time are so important. And we want to continue to nurture and grow those relationships, not just for the sake of the county, but for the sake of our residents. And so I would say that, having those relationships with community and being able to leverage, our excellent medical director, her advice, and our team of people in public health that our community members trust, or they're beginning to trust, is going to be really important in our ongoing response. So thank you for that question.
I appreciate that, and that's a great answer, and we'll look forward to more information on that. So we know that the public doesn't always have to wait for a conversation with Dr. Ogawa. They can call any of our offices, or I'm guessing that there's a number that they can call at the public health offices that if people have questions. So we can remind people that they can go on our website and ask questions there whenever they have them.
That's correct. And we're still giving out masks. We still have the Mask for Everyone initiative happening here at the county. So you can still request masks, and we'll mail those masks out to you. You don't have to come out and pick them up. And so again, those mitigation strategies, mask wearing, getting vaccinated, and then testing is going to be really important.
Thank you. Thank you.
Thank you, Commissioner McGuire. We'll move on to Commissioner Matas-Castillo and then back to our team for the completion of the update. Commissioner.
Yes, thank you, Madam Chair. And this goes to prove that the community is eager to ask questions and listening. I just got a message in via Twitter from Representative Jamie Becker-Finn that said, how many breakthrough cases are due to unvaccinated folks spreading it to the vaccinated? Every breakthrough case in her circle has been unvaccinated kids giving it to their parents. And so if someone would like to answer that.
Chair Carter, Commissioner Matas-Castillo, I don't think we actually know. Anecdotally, I think we can agree that these cases are primarily being transmitted by individuals who are unvaccinated, but I don't know that we have that data available. Dr. Ogawa, is that accurate? Yeah, she's nodding. So yeah, stay tuned. I think over time, we'll get more interviews done and we'll probably have a better sense of what that looks like.
We don't have any data for us locally. There was a reasonable study done in Europe that looked at very close exposures, individuals within a home, and they did still show a reduction if both individuals were vaccinated, a reduction. It depended on the vaccine. So, but anywhere from 65 to 90% where they reduced transmission. But it was highly variable, we'll just say, because it also depends on, right, a setting, how close you have to be to each other regularly. And if you can truly isolate in your own room or things along those lines. And so it's a little bit of a guess, but that's our best estimate, is that vaccination reduces even close transmission probably by 70 to 90%, hopefully. Yeah.
Thank you for the question. Certainly we see that in our experience. I will go back to the team for the completion of our update. And I know Dr. Ogawa was moving it forward. I'm not sure if that is to County Manager O'Connor at this point, but you all will let me know.
Madam Chair, thank you for giving us a chance to answer questions and give updates. It is a time where, we're hopeful when you look at, unfortunately, like when you look at the South, you can see the Delta wave roll through a region and then the backside of that, if you look at the transmission spreads across the country right now. And we're seeing that here because of our vaccination rates, our arcs and the declines and decreases can look a little bit different, but that's something that public health continues to talk about with us. We're hoping to get through this holiday season in a decent spot, but there's a lot of unknowns to get through the holiday season. Many of these questions elicited that. And all of that also matters to our rate of transmission and what it means for us meeting virtually and for our organization moving forward and for the models of service delivery we think about. So it remains in front of us. On our vaccine and testing policy status update, just briefly, we've had 3,650 employees respond. Of that, 80% are vaccinated, right? These are approximate, but very close right now, which is a good sign. Of the few hundred that have responded as not vaccinated, most of them are being tested. There's a part where if you're not around the office during the period, there's a piece there where the numbers don't tick out perfectly, is what I would say. But of the 142 tests last week that were then conducted during this period, 3 came back positive again, which again gets to that point of keeping every case out matters as we move forward. We still have about 1,500 individuals who did not certify by the time that we needed to see this past week. And what I can tell you from looking at that on a more disaggregated level is there's more than 100 of them that I know simply need to certify just based on the part of the org they're in and the requirements that exist for them. It's one of those things where there are requirements beyond county requirements. And so how do we make sure those individuals certify their status? So there are names on this list where I know there's action that has been taken. This week begins the first week on the steps, though, of then what does it mean to go through a graduated process over the next month to bring forward the process to ensure compliance with the county's policy. And so departments are going to get names back, or like the names back this week. Those specific communications to individuals who have not complied with the policy begins this week. And that moves upward over the coming 3 weeks after this as well. And so I'm hopeful that this week's focused communication efforts that move from general to specific have a significant increase. And sometimes we all know, like, you need that jolting email of your pay, your time card's not filled out, and it changes it from the reminder of please fill out your time card. That's this week. And then beginning next week, it becomes the next step along that process. And so we're taking it seriously. We're into that part of the process. Just wanted to share that update here and appreciate the work of HR and the entire organization to move ahead. That's all we have, Madam Chair. Thank you for the opportunity.
Thank you very much to all of you. We really appreciate all of the work. Certainly, there is no fatigue in this group as you continue to elevate all of the processes for vaccination and testing and focused, or I should say layered mitigation, such as you shared with us here. It is a bit disheartening to see where the data says we are today, but we know that we're in that process of addressing the variant, and we have a lot to do to get beyond our COVID pandemic. We're working in that regard, and thank you to Incident Commander Anderson, to Director Holly, and also to our Dr. Ogawa. We look forward to times with you again where we will hear more positive updates about our status. And in the meantime, we'll take our small amount of time just for a moment of meditation in regard to where we are today as we move forward in our meeting shortly. 20 seconds for our moment of meditation. Thank you. In no way does the time that we're spending in this moment indicate the lack of seriousness about where we are. We appreciate all of the work. And with that, we'll move on with our administrative agenda. I'll call on Commissioner McGuire to take us through.
Thank you, Madam Chair. I move the following items. Item number 5, bonuses and financial incentives to hire and retain registered nurses at the Ramsey County Care Center.
Madam Chair, I'd pull item number 5.
Thank you. We'll pull that. Item number 6, name change of the Chemical Health Committee. I move item number 7, agreement for Ramsey County Library in Maplewood Design, Build Part 1. And item number 8, second amendment to lease with the Hmong American Partnership. Item number 9, American Rescue Plan Act funds for violence prevention initiatives. Item 10, American Rescue Plan Act funding request for Tier 1 priority administrative items. Item 11, September 2021 report of contracts, grant and revenue agreements, emergency purchases, sole source, single source purchases, and final payments.
Second.
Thank you very much for the motion and the second. All items have been moved forward with the exception of number 5. We have a motion and a second. Is there any discussion before we call for the roll call on those items? Thank you. Then we'll ask for the roll call on all items except number 5.
McGuire,
Aye.
Ortega,
Aye.
Reinhardt,
Aye.
Radam,
Aye.
Mattis Castillo,
Aye.
McDonough,
Aye.
and Carter.
Aye. Thank you very much. And we're back now then to item number 5, which is bonuses and financial. I should have mentioned that all those items passed. We're back to number 5, which is bonuses and financial incentives to hire and retain registered nurses at the Ramsey County Care Center. I'd ask for a motion and a second to get it on for discussion.
Madam Chair, I'd actually propose a substitute motion.
All right. Let me then ask for your substitute motion.
Thank you, Chair Carter. I would propose a substitute motion that would direct the county manager working with Deputy County Manager Hadeen, Director Barry, and CFO Kutza to come back to us with in a short-term plan that would not focus on increasing the census and strategies to accomplish that, but focus in on meeting the needs of our current residents there and supporting the staff in doing so. And then in the first quarter of 2022 to come forward with a longer-term strategy as far as moving forward and supporting seniors in our community and what that looks like for Ramsey County. That would be the proposed substitute motion. And just a couple of quick words here. I recognize the RBA that came before us, so it was developed by staff, was really to help support staff in managing and providing services at the care center in a way that we would expect in the County of Excellence. And the strategy of increasing the census and bringing on more staff in a way that does that would bring in more revenue. This substitute resolution really focuses in on the quality of services that we can provide for the current residents and supporting staff in doing so.
Commissioner
Madam
McDonough.
Chair, I would second.
There is a motion by Commissioner McDonough, a second by Commissioner Reinhardt. And before, I'm sorry.
And I was trying to raise my hand, so just pretend the hand is up when you get ready to call on people.
All right, I will pretend your hand is up in order. Thank you so much. So we've heard the substitute motion and we have heard a second to that motion. We are in discussion to begin our discussion to provide context for the discussion itself and for the decisions that we are in the process of making. I will call on County Manager O'Connor to summarize the recommendation and to place this second motion in context, substitute motion, I should say. County Manager O'Connor.
You're on mute.
I think that's my first one here at the board, so I've joined the club. Thank you, Madam Chair and members. I'm going to repeat back the substitute motions as I've heard them, just to make sure we're tracking with pretty specific language, and then I'll answer the contextual question the chair asked. Direct the county manager to return with a short-term plan to focus on current residents and operational needs during the current COVID wave is how I framed that, if that might be okay by the proposer. And the second piece was direct the county manager to return with a longer-term strategy after the current COVID wave dissipates. So I tied it to the spread. I don't know if Commissioner McDonough is okay tying to the spread. I would just say that aligns probably with short-term, long-term, but if, other than that last piece, did I hear that right? I wanted to clarify that before I answer the context. Is that okay?
Yep, that's fine.
Okay. Thank you, Commissioner. Madam Chair, members, you received some written information last week about what the original request for board action proposed. I'm not going to dwell on all of that for all that long based on the substitute motions here and a piece to it, but there's relevance to some of it. I'll just frame at the outset, which is I want to note the challenging time during COVID that care centers across the state are facing, and that's no exception here locally on our end. And what you saw was a request for board action attempting to minimize revenue losses generated predominantly from the fact that census levels are down by a relatively significant, I would say a significant amount, right? We are down from where we have been in the past at 135 down to 109 in the RBA as it was cited there. And much of that stems on the staffing side of not having enough nurses to be able to accommodate a higher census, even if there were an opportunity to do so. This was an attempt to talk about how revenue could be stemmed. I think the response here today, what I'm hearing in terms of the proposed motions as the substitute, recognize the need, as other sites around have also considered, that there are moments when the focus on census may not be the correct focus, that the focus should be on who is currently there, meaning who as in current staff and residents that Ramsey County sees as a part of the current system. And with that, Madam Chair, I would stand for any questions or comments on that. It's clear to us. I would be happy to go back and follow through on those resolutions. And we believe that that's an important overall governance direction from which we can operate.
Thank you, County Manager O'Connor, for that context. And we do very, very much appreciate the hard work and effort of our staff to apply the best solutions for quality care, particularly at such a time as this. At the same time, we appreciate the recommendation for a substitute motion, and we are in discussion on that motion at this point in time. I think it's important to hear from board members with respect to this motion prior to moving forward. I see Commissioner Reinhardt's hand up. You did it. And I am going to call on Commissioner Reinhardt.
Thank you. I'm sure that there are some folks that probably were surprised that I seconded Commissioner McDonough's motion, but I understand that we need to have these discussions, and that's important. We are policymakers, and we need to have the longer-term discussions. I especially appreciate the fact that I was concerned initially as far as pulling this, because I want to make sure that the current residents that are there are getting the care that they need. And so that was taken care of by breaking it into two, because we all know that, and especially during a pandemic and this fourth surge, and who knows if we're going to have other surges too, or what's going to happen there. But, you know, trying to deal with the situation we're in right now, and that may go beyond the first quarter of the year. I hope not, but you know, I guess we just have to go with what is happening and figure it out from there. And one of the reasons that I wanted to second it was to show that I am open to listening to what people have to say. But I have to tell you that I feel very strongly, and because what we're considering here, and I hope that it's not just a recommendation that comes back from the county manager, but that there is discussion by this board, because clearly what's being talked about here is closing it, not not operating it by Ramsey County anymore. And that's been a discussion we've had for a number of years. We've made changes, we've done things. But my core belief here is that I believe in the continuum of care. And just as I fight hard for, services for mental illness and disabilities and children, early childhood, education, all of those things are important. And those are more on the front end or the middle of the continuum of life. But I feel very strongly about those that are in their senior years or disabled to a point that they need to have what is traditionally called nursing home care. And I know that this is a smaller group of people, but these are the people that paid taxes all these years so that they could have the care that they needed. And this is just one option, but let's face it, all the other things that we do, there are other options that are out there, whether it's childcare or early education or any of those things. The private sector does a lot of it, but the county, this is Health and Human Services is about 50% of our budget. So we are spending money on other things that are really important to the quality of life. And I feel that for our senior population and those that are served in this particular setting, that's important. I know that one of the reasons that we have a higher cost is because we have union labor there. So in order for somebody to have, and they make, comparably, they pay more money, but I think they're worth it. I think that because the private sector and some of the nonprofit sector, they get paid less, but is their work any less valuable? I don't think that it is. And so I'm not saying that they get poorer care either, but I do think that, showing that we pay for what we think is valued labor is important. And so as we go through this discussion, I will continue to reiterate my core values here. And I'm not saying that others don't care about seniors, so please don't take it that way, because that's not what I'm thinking at all. Because I know this is a smaller group of people when you consider all the seniors in Ramsey County. But it's a group of people that I think they wouldn't be there probably if they had a lot of other choices. And I don't think, I don't care where it's at, the nursing home, like Wasso, any of our facilities, we have the best staff. They care about the people that they are serving. And so I want, again, everyone to know that, that I value that and that I value the service they provide. And sometimes, in a lot of things that we do, it's not just about the bottom line. We provide the services that we need to provide because it's the right thing to do, and try to minimize the costs, or in this case, the original proposal was to increase the census to minimize the losses. And that makes sense if that's what we determine to do. But I don't want to lose sight of the fact that these are individual workers, individual people, family members that count on the services here. They're able to stay close to home. And this is for Ramsey County residents and their seniors. And I don't want to lose sight of the individuals and their families, because we're a big county. We do a lot of things. And sometimes that person can get lost in the shuffle. These are people's lives, whether they're workers or family or residents.
Thank you.
I look forward to the future discussion, but I need you to know exactly where I'm coming from. And I will reiterate those sentiments as we go forward. But I do support the short-term and the longer-term as long as there's county board discussion in that.
Thank you very much, Commissioner Reinhardt. I will certainly reinforce the values that you have shared on behalf of all of us. We really do want to recognize that we have a responsibility to diligently care for those residents who have chosen to be with us. And we have employees who are faithfully executing that duty of care. We want to be certain that they have the resources that are needed there. In the short term, to care for those residents who are in our care center today. And as we think toward the long term, we want to be sure that we have provided for the greatest opportunity for that continuum to exist and to be a choice for all who need it. I am looking to the screen to see if there are any additional hands up before we move to a vote on this item. I see Commissioner McGuire. Commissioner McGuire, I'll call on you.
Thank you, Madam Chair. I just want to say I appreciate that Commissioner McDonough pulled this. I think it is the board decision. It's a board responsibility to look at the overall governance of these in these issues, and we do care about our residents there. We care about our staff. We want to make sure that they have that our residents have the best care, that our staff has the resources they need, and I'm looking forward to the upcoming discussions on the shorter term and longer term strategies. And I just wanted to say that I'm grateful for the discussions that we're going to have.
Thank you very much. I appreciate all of the input that we've had. This is certainly a difficult time for our care center. We want to be sure that we are able to address the human perspectives, the financial perspectives, the operational perspectives, with appreciation for this substitute motion. Looking to the screen for any additional comments. If there are none, then we want to make certain that we call on the clerk to call the roll. I see no additional hands raised, and I'll ask then that the clerk call the roll on our substitute motion.
McGuire,
Aye.
Ortega,
Aye.
Reinhardt,
Aye.
Freda,
Aye.
Maras Castillo,
Aye.
McDonough,
Aye.
and Carter.
Aye. I want to thank you very much. That motion has passed. Before we move on, I'll go back to the county manager just for a wrap up of actions that will take place following this vote as he returns to the board. County Manager O'Connor.
Thank you, Madam Chair and members, for the discussion. I think the short-term piece here is really putting that focus on who we're serving today and shoring things up. This is not the first time you've received an update on this, but as this Delta wave has come to Ramsey County and the state of Minnesota, we have the worst 7-day case rate in the country, as you heard this morning. It's come to our care center, and we've had a number of residents that have been impacted, have been on the COVID ward, and unfortunately a handful have passed away due to complications from COVID-19, all within the last few weeks. We've had more than 36 staff screened out because of the protocol that go on. And this in a building in which you see vaccination rates hovering at or around 90% on both sides of the staff and resident equation. It's a really hard time. And more than anything else, I appreciate the recognition from here about the human toll and impact these moments have. And we appreciate your support in that space during this tough time. We will be back with some specific information for all of you sooner rather than later about what the short term can look like. We have a wise and powerful team that we can engage to talk about that short term need, and we'll get a date set for the longer term piece that feels a little beyond this current moment of the COVID wave and carry forward from there. Thank you.
Once again, thank you to the board for this vote and to the staff for all of the work that you have done to think through options so far, and for the work that you will do to come back to us with short-term solutions. And as we think through the longer term as well. Thank you so very, very much. Let's see, we have then the rest of our agenda. and a policy item. I'm sorry, I've got something in my throat here too. Expansion of the employee COVID-19 proof of vaccination and testing policy to all Ramsey County elected officials. I want to ask that, I'm sorry, we are aware that when we first passed the policy, it did not apply to elected officials. I want board members to know that that item has now been covered with those electeds. They have been informed, the sheriff and the county attorney, of this request to extend the policy item to all of us. I'll call on the county manager for any, well, let me get this item on first, the motion second.
Madam Chair, I'll move it.
Second.
Thank you very much. There is a motion and a second, and I'm not certain, but I will call on the manager in case there is an update for this item. County Manager O'Connor.
Madam Chair, members, I'll just note that in terms of the data reporting of who is compliant within the vaccine and testing policy, this will now ensure that we'll collect data for all elected officials as well and count you in the eligible group. So if you have not uploaded your status, I would ask you to please do so, or you'll receive an individual email sometime in the next week. Thank you.
Thank you. And is there not a vote on this item?
Madam Chair, this is one for action. Yes, there is a
Thank
vote
you.
to actually do it.
All right. So as this passes, we'll ask everyone to update their status if not already done. Is there additional discussion? I see Commissioner McDonough.
Thanks, Madam Chair. I just wanted to make a quick comment because it's always frustrated me that Congress exempts itself from almost every law it passes for our U.S. residents. And I was surprised that we were not, or all the electeds were not included in this. And I would suggest in the future, anytime there's a similar situation, we should always be included unless our county attorney would tell us that there's a strong reason on why we shouldn't. It should just be assumed and automatic that what is good for our residents is good for us. Thank you.
Thank you very much, Commissioner McDonough. I think for the fact that we are an elected body, we certainly can include ourselves in any policy that we should pass. Of course, we are an elected body as a county board. We have other electeds as well, our county attorney and our county sheriff, who don't sit at this table to make those discussions with us. I am thankful that I did receive an endorsement in talking with the county attorney for this policy, and we have also notified our county sheriff of it as well with no objection. I see Commissioner Reinhardt here. Thank you.
Yes, and I just wanted to say that I thought we were included from the beginning, so I uploaded my data right away. So I'm glad that it was caught that we weren't actually required to do that. And I agree with Commissioner McDonough that, we are employees as well as elected officials. And so these things, we should not be exempted from it. And I do have the same issue with at the state legislature and Congress. Oftentimes, the electeds exempt themselves, and that makes no sense to me. So this is common sense and obviously something that's really important as role models.
I appreciate that common sense comment. I see lots of heads nodding as well, and no additional hands raised. I believe we are ready for the vote. Would the clerk please call the roll?
McGuire,
Aye.
Ortega,
Aye.
Reinhardt,
Aye.
Fretham,
Aye.
Matas Castillo,
Aye.
McDonough,
Aye.
and Carter.
Aye. Thank you very much. And with that vote, all county employees, electeds included, are in alignment or asked to be in alignment with the policy. Update your data and certify right away. We're moving on then to County Connections. County Manager O'Connor.
Thank you, Madam Chair and members. CFO Kutza just joined us. I'm going to hand over the first county connection to her.
Good morning, everyone. Thank you, Ryan. So I'll be sending out more information shortly, but I did want to update you. We got some information from the Minnesota Intercounty Association about overall tax levy for 2022. And Ramsey County, with our 1.5% proposed increase, is ranked 9th in percent change out of 87 counties. The statewide average is a 3.7% increase in 2022. Overall, Ramsey County, for county levy per capita, so the amount we pay per capita, is $613, and we rank 20th out of 87 counties. Last year in 2021, we were 23rd, so a little lower, like 20 out of 87. And the average, our 613 compares to the average statewide of $634 per capita. So, I mean, I think that just shows that's a very solid showing for the county, and that we're recognizing the moment in time that we have. We're under the statewide averages in both places, and we've also had a disproportionate impact from COVID and the resulting economic downturn in our county, and I think that recognizes it. So I'll share all that data with you in an email, but I just wanted to raise that up to you as we come into December and passing of the budget. Happy to answer any questions.
Thanks, Director Kutza. We will get that out in writing because there's a lot of numbers. I do think there's this challenging piece where we know the needs are great. Alongside that, the impact has been greater in terms of COVID here than in many other places, and balancing that. I would hope that what this demonstrates is we have found a way to balance that in the proposed budget as best as possible and through the deliberations with the board to date. Turning to a couple other areas in which I have some good news stories I wanted to share. I just wanted to lift up the work that's been going on. It's a partnership between Human Resources, Workforce Solutions, and then other public partners around pathways and leadership opportunities, both within the county and public sector more broadly. There are a series of informational sessions coming up on things like, do you want to learn how to drive a bus, snowplow, or other commercial vehicle? And there are a ton of dates coming up. Ling Becker, our Workforce Solutions Director, has been working very closely with Nolana Gates, our Public Pathways Coordinator in Human Resources, who you had an opportunity to meet a few months ago at a Lunch and Learn. But there are sessions coming up on the 17th of November, December 1st, December 7th, December 15th, January 11th. These sessions include meeting with potential employers, overview of available jobs, how to earn and maintain a CDL, commercial driver's license, and a Q&A session as well. And so Ramsey County has leaned very heavily into this in partnership with state and some of our other like core county and city partners in particular who show up on here. I just wanted to highlight that as one of those demonstrations of both leading and partnering in ways that hopefully create opportunity, aligned with our goal, both within Ramsey County, but also for Ramsey County residents throughout the broader region around us. Two other final updates. I sent this to all of you last week, but just wanted to highlight it here, that in the areas for the Association of Minnesota County Awards, we nominated a series of awards or individuals and programs this year. Excited to see how that follows through. Even the nomination is an important moment, though, to call out the good work. And this represents a lot of good work that didn't get nominated here that we need to find other opportunities to continue to lift up. But in the areas of AMC Outstanding Service, we nominated Deputy County Manager Kathy Hadeen. In the area of Outstanding Economic Development, our Economic Competitiveness and Inclusion Plans, Development, Publication, and Adoption, which involves Community Economic Development and Workforce Solutions. In the County Conservation Award, the Aquatic Invasive Species Program coming out of Parks and Recreation. And in the County Achievement Award, our work around growing numbers in census and election turnout, which led to the highest census response rates and the highest election response rates we've seen in Ramsey County. Obviously, that comes out of the Elections Office and in a partnership with Policy and Planning out of the County Manager's Office. Alongside that, Ramsey County nominated 2 individuals for the Young American Leaders Program, which is a partnership that occurs both here in the state of Minnesota and an opportunity to be a part of a cohort that takes place out at Harvard University. We were excited to nominate Prince Corbett and Carrie Collins as the 2 individuals from the county in that space as well. And again, like I said with the other piece, it's always hard to nominate because you stare at a list of more deserving individuals than spaces. And so it's important that we think about other opportunities as well for a dozen names who do not get reflected here but are also at the forefront of leading important transformative work. We're very hopeful that these names move forward in a way where they can both represent Ramsey County and continue to grow in their leadership. Madam Chair, I'm going to pause because I see a hand up before I transition to my last item.
Thank you very much. Commissioner McGuire.
You're on mute.
You're on mute.
Thanks. Thank you for calling on me. I'm just glad to see that we're nominating amazing employees and amazing work that we're doing. We all go to these conferences and these award ceremonies where lots of people are getting awards, and we know that our county is doing incredible work. And so I'm really happy to see that we're nominating all of these worthy recipients to these for these awards. And I hope they prevail. And even if they don't prevail in that award ceremony, we know that they're winners in our books. So I just appreciate that they're being nominated.
Thank you, Commissioner McGuire. And for my final update, I got another gem I wanted to read a little bit to you from something I recently received. We had one a couple weeks ago, obviously, from the individual who had been in Right Track. But Deputy County Manager Hadeen was kind enough to share with me a response that she got to send back thanking an employee for a recent interaction. And this gets to the point that we talk about leadership at all levels, and who the face of this organization is not just the programs and names we just gave. It's everybody in different moments. I want to give a shout out to an employee, Christopher Quinzen. And he was highlighted in the best of ways this past week. Deputy County Manager Hadeen received a call from a resident that had been connected with, and she had been frustrated because she had had her benefits shut off for a period due to missing a renewal deadline. She had a really good conversation though, and they spent over a half hour talking about how impressed she was with the ability of Christopher to listen to her, even though she was upset. She said, "You were the most respectful person I have ever worked with here at Ramsey County. You treated me with empathy and respect, and even though you couldn't change the outcome, you walked me through what happened and why it happened, and went as far as saying you should promote this individual moving forward," which is all great. But you know, these things pass through on many days, but we don't always get a chance to daylight them. And I wanted to publicly say thank you to Christopher for representing so many of our employees day to day, and for continuing the work to serve this community in moments of need during COVID and beyond. Thank you for letting me share that here, Madam Chair. With that, I'm done.
Thank you very much for the update. And indeed, there is stellar work going on. We appreciate knowing what you've shared regarding our county levy, our rate, our per capita, regarding the work that's going on in workforce solutions and the information sessions coming up. You have talked with us about the awards that you've been able to nominate for our county. And thank you to so many for the incredible work that they're doing. And finally, yes, this reaches to every corner of our county. We're all included as we focus on our vision of a vibrant community where all are valued and thrive. And we think about our mission and our goals. Each individual in our county makes that work. And so thank you so much to Christopher Quinson as well. Thank you so very much for your work, each individual in Ramsey County. And I will turn now to our county commissioners for our board updates, beginning then with Commissioner Ortega.
Thank you, Madam Chair. Quickly here, I'm going to give some kudos to the Westside Citizens Organization. They had the annual meeting last week, and it was a great turnout. Over 100 people showed up, and congratulations to the new board members. It was a very good meeting. Also, we presented, we had staff present at the Highland Transportation Committee. I was there, and the West 7th Transportation Committee, both on the Riverview corridor and on the Lexington Avenue Parkway project. Many of you are not familiar with the Lexington Avenue, but we are, part of that is a county road and a city road. We're putting in, we have already completed phase 1 about a year ago. We're completing the planning of phase 2, which will connect Lexington Avenue all the way to the river. We will take over Elway Street once the project is completed, so that maintenance will be ours. And it'll be the first mini what do you call it, roundabout in the city of St. Paul to ease traffic. We've had quite a few. I must have attended at least over the last year 4 or 5 open houses on the Lexington Parkway. And this is the consensus. The staff, Nick Fisher, who's in charge of, who's our lead staff on that project, has done an excellent job along with others to really get community participation. And I got to tell you, the communities, this is their project. They've picked the options and how they like to see it, and we've got great consensus on that project. The other is attended the Landmark Board of Directors, and I can tell you that I forget the figures now, they were on top of my head, but we did very well. We came very close to pre-COVID status for the fundraising amounts that from the gala we had, and that's great because that money goes directly to our programs, which is about, you know, having the type of program we have at Landmark, which has always been very, very diverse and inclusive of all the groups, and to show their culture and their you know, their music and their dress and so forth. So, Madam Chair, I am going through my calendar here. That I'll leave it at that. Thank you very much.
Thank you very much, Commissioner, for sharing those samples with us. And I'll turn to Commissioner Reinhardt.
Thank you, Madam Chair. And I also was in the Landmark Board meeting, and it is really heartening because when I'm trying to think how many years it's been now, but the gala was something that was thought up as far as kind of an ongoing community involvement, community engagement, and fundraiser. I mean, that's its purpose, but it brings people together and reminds them of what a gem we have at Landmark Center. And so it was an idea that started, and we started, well, must have been probably in the 1880s or something like that, as far as the theme of it. And so it's been going on for quite some time, and it's so much fun. And so I especially, and I think I commented on this last week, actually, the Commissioner Modis Castillo and her husband, Hector. Oh my gosh, it was great. And all of the other people that just enjoyed the evening, whether they were dressed in the 1980s or not. Anyhow, I have to tell you though, I think Hector looked a little too comfortable in that in that outfit. Anyhow, on a more serious note, the Clean Water Council met yesterday, and there are a lot of really important things that are happening, and especially with climate change and PFAS, and just really trying to look at what is happening and what role we as Minnesotans can play in turning that around to the extent that is possible, and how much we enjoy the environment and all of the water that we have, but we need to make sure that it's not just something we enjoy, but something that we protect and restore. And obviously the Mississippi River is a big part of that as well. So there's a lot of activity going on there, and it is really heartening to see how much people are really kind of hunkering down to say, okay, what can we do? What should we do? And what, you know, we must do now. And I think the talks in Glasgow have been a part of kind of providing that little extra push that we needed right now. So there is hope, but there is work that needs to be done. So we need to get that done for future generations. And honestly, it's not even just future generations, just like, you know, 5 to 10 years from now, if we don't do something now. Anyhow, I think that I will leave it at that so that we can move on to our next agenda items.
Thank you, Commissioner Reinhardt, for the hope and for the work. We appreciate it. Commissioner Fretham.
to Commissioner Reinhardt's point, she was also present for the NCCG meeting, I believe, last week with our concerned citizens group in the White Bear Township, White Bear Lake area around that formed around to respond to the issues with the water gremlin facility there. They are continuing to meet and advocate for their community and for higher safety standards that would impact all communities so that no one has to go through the pain and the fear that they've experienced due to their own exposure to toxic chemicals. Also continuing to work, making good progress with the Community Action Partnership of Ramsey and Washington counties. We're doing a lot of board development work right now, which is very exciting with our new executive director, and we have a consultant to make some improvements. So moving forward with that work, and they are in desperate need of early childhood teachers so they can continue to open additional Head Start classrooms that they have funding for. Some of them are under construction. So hoping that we can connect with our Ramsey County workforce team, because we have been having a lot of discussions in our early childhood subcommittee that Commissioner McGuire chairs and I joined her for, on how Ramsey County can really target development of our early childhood care and education workforce. So lots of opportunities for connections in the coming weeks. Thank you.
Thank you, Commissioner Fretham. Commissioner Matis Castillo.
Yes, thanks, Madam Chair. I just want to share a couple exciting events coming up on our calendar. Tonight is the Rice Street Open House from 6 to 8 p.m. This is when the community will see the final design selection from our redesign, and I appreciate everyone who has worked really hard. Our Public Works team has worked for several years, as you know, really getting in with community to see what that final design. I think everyone will be pleased when they see it this evening. So 6 to 8 to tune in, ramseycounty.us/Rice Street to see that final design plan that really meets the needs of our community, prioritizing pedestrian safety, bike infrastructure, our new transit and BRT lines as well. So exciting stuff. Also on Tuesday, Thanksgiving is coming up next week. And so just want to share that Feeding the Dream Frogtown is distributing Thanksgiving food boxes at the Brownstones at Victoria and University for anyone in the community in the afternoon. If you are looking for food items for Thanksgiving, there'll be food boxes given away to community next Tuesday. And then lastly, to put on your calendar coming up, because it's just around the corner, December 4th, our Rice Lavender Alliance is doing a winter warm-up event with hot cocoa and distributing our new Rice Lavender shopping guides and connecting with community on the afternoon from 1 to 3 on December 4th. So add that to your calendar as well. Thank you, Madam Chair.
Thank you. Lots to do coming up. Appreciate it. Commissioner McDonough.
No report, Madam Chair.
Thank you, Commissioner. Let's see, Commissioner McGuire.
Thank you, Madam Chair. Just a couple things here that I want to give updates on. The St. Paul Children's Collaborative met with Commissioner Carter and I were there. One thing that I was really appreciating that collaborative did was to invite the other collaboratives to come and talk about what they do and how they do their work. So they invited Mary Sue Hansen from the Suburban Ramsey Family Collaborative and Wendy Goodman from the Ramsey County Children's Mental Health Collaborative, and they both gave updates on what their collaboratives are doing. And I think it's a really good thing that the collaboratives know what the other ones are doing. And so it's trying to help that work be collaborative. So I was glad to see that happening. The Ramsey County League of Local Government met last Friday there were about 15 people on the call. It was wonderful with our different cities and school districts. The National Alliance for the Mentally Ill, NAMI, gave a training. It's a wonderful training, and I'll see if I can send it out to any of you if any of you want to look at it. It's just how to engage your government, but it's really great. And then you can forward it on to other people that you know, because most of us on this call will know a lot of this, but it's really great to see the trainings that they have. And then they do, of course, talk about the issues around mental illness and mental health in our community, and they gave their legislative priorities. And so hopefully our cities will be incorporating some of those priorities
in their legislative package. We at Ramsey County do also already do a lot of this and are going to be doing a few more. And you'll be hearing about that in our next in our workshop that follows this board meeting about our legislative package. So it was just really a good